On this episode, we welcome Scott Martindale from Republic, all the way from Dallas, Texas?
Just about, yeah.
Dallas, Texas, to join us here in Omaha. Atlas All Access starts now.
From Kirkham at 0450.
All right, Scott, welcome.
Thanks for having me. It's amazing. I love being here, and
Yeah?
it's great atmosphere. Just great to see you guys again.
How has Omaha been so far for you?
You know, it's been pretty limited.
Okay.
So I've seen the airport, I've seen my hotel, and I've seen Atlas.
Yep.
So, and that's kind of pretty much the only reason I'm here. So,
If you mix the zoo in, then you've seen it all.
is that it?
No, I'm kidding. I'm totally kidding. Omaha,
I think there's something on the outlying skirts that I've just not seen yet. But ultimately, before I got here and before I met you guys, I only knew Warren Buffett was from Omaha. That's the only thing I knew about Omaha.
Yeah.
So I keep waiting to see him, but I haven't seen him yet.
Well, we can go to a steakhouse down like on 50th and
Yeah.
Center.
Yeah.
That's where he hangs out all
All
the
right,
time. So.
cool.
Or at the Dairy Queen, one of the two. That's, no kidding. Like those are the places he goes or whatever. So
Well,
actually, his house isn't too far from here. Like
Really?
it's not. It's probably a 5-minute drive from here. It's not far at all. So.
I like Omaha. It reminds me. I grew up in West Texas, so this is kind of West Texas-ish.
Where in West Texas?
Abilene.
Okay.
So it's just kind of a quaint community. It's nice. People are nice. They got steakhouses. It's all good.
That sounds like Omaha.
I love it.
That sounds like Omaha. Okay, so let's. I got a couple questions for you, and I think let's start at the very beginning.
Okay.
Because we've chatted about this before.
Mm-hmm.
Where'd you get started?
Like
In our
Republic.
industry.
Okay, so Republic was actually created. I have two backgrounds. So I'm a clinical therapist who married a nurse, and we had an idea, and we wanted to start a recruitment firm that would focus on travel nurses. We wanted to create something different. So my wife and I basically took the chance and created Republic. But it stems. I mean, working with nurses for us, it's the best. It is. I love nurses. I married one. But I've had such a good history with dealing and working with nurses, and just the experience that I've had with them. They're just the best people. They get to deal with the best in humanity, and they have the humility to deal with the worst. And every day we get to work with them. It's a privilege. It literally is a privilege. And we just want to do that and do it better. So Republic was created in my living room, and it was never something, I never envisioned it getting a whole lot bigger. I don't know. And then we've just been blessed. We've been blessed with great people. We have great teams, great partnerships, and it's just continued to get bigger. And continued to work with more nurses, and we continue to try to do it better.
So tell me about Republic itself. Like, how long has it been around?
Sure. We're about 6.5 years old. So
like us.
yeah,
Okay.
haven't been around for 30 years. We are 6.5 years old. We're based just outside of Dallas, like right between Dallas and Fort Worth. We've got about 65 employees internally, and then we have several remote employees that work different places. So that's kind of us. We do travel nursing. We do executive leadership. We're getting into doing more locums and advanced practice nursing. So it's a great group, great core group of good people. So
Interesting. So Dallas is one of those areas, because not that we're going to do this anytime soon,
Yeah.
but Dallas is one of those areas where a per diem company would thrive.
Sure.
Have you done any of that?
No.
Yeah, that's
No, I'm all for per diem companies. It's just not something that fits in our wheelhouse. It's a tough business.
Yeah.
But yeah, I mean, Dallas has got a great healthcare market. I mean, with between HCA, between Tenet, Baylor, Texas Health Resources. I mean, it is huge, and it's conglomerating. So Memorial Hermann just merged with Baylor Scott and White.
Yeah.
So now you're going to get basically Texas is going to represent the largest privately held healthcare system in the nation. So with Memorial Hermann and Baylor Scott and White merging. So it's just a good place. I mean, as far as healthcare goes, it's great.
Yeah. So and you mentioned it a little bit, everybody says they're different, right?
Yeah.
Tell me how you're different.
You know, that's a great question, and it's so hard to define. And I think that I would say that Republic is different for a few reasons. Number one, we're a faith-based organization, and that's something that's a little bit more unique in our industry. Mm-hmm. But it's something that we really try to practice, and try to practice in our values, try to practice in our daily interactions. It's just something we want to give people in terms of access. Mm-hmm. So I think that resonates through our culture a lot. The other difference is we're constantly, and I think the fact that I'm here, it represents one of the reasons, and the friendships and the partnerships we have with Atlas and a few of the other firms, that we really do want to make a great industry, and we want to make it great for the nurses. Mm-hmm. So that takes collaboration. It doesn't happen in a silo. It doesn't happen just by one person having an idea. It takes multiple companies getting together and saying, hey, listen, let's not be the recruitment firms of the 90s. We're not out to kill each other. We're literally wanting to collaborate with the best of the best companies, and we do that at a very high level. And how are we doing things? What are we going to do differently? How are we treating nurses? What are the nurses? What do they deserve, and what do they need, and how do we need to respect them and cater them and service them? So that happens collaboratively between a lot of companies that I think automatically makes us all a little bit different.
Behind the scenes, there's a lot that I think some might be shocked to know, right? I mean, how much we do talk to each other. Because you're right, for the longest time, everyone just assumed that we all hated each other.
Yeah.
And it was super cutthroat and whatever, and it really was.
Yeah.
And I don't know where that came from.
I mean, I think that the mentality of recruitment back in the early 90s was very much like that. Mm-hmm. I think today, yes, I'm not surprised, because that's, I think, a lot about who we are, like you and I and Steve. And I mean, these are people that, Steve and I talk almost about every other day, about, hey, what's going on in the industry? How do you like this? I have this situation, how would you handle this? Whether that's dealing with our internal employees or our programs that we're launching for nurse benefits or things like that. It is literally about how can we as collectively as companies get better so that we can service the nurse better.
Right.
We are constantly pressing the envelope of saying, how can we do it better? And everybody has different niches. Mm-hmm. So things that you guys do are great, and they're collaborative with some of the stuff that we do. But we may do it differently, and that's okay. Mm-hmm. But as an industry, we are getting stronger because we are talking together a lot.
You're 100% right, and it only is going to make all of us stronger, right?
Yes.
And it's at some point it's going to be either you're on board or you're not.
Yeah.
Either you do it the right way or you don't.
Sure.
And that's, I hope it's after almost 15 years in the industry now, and seeing it both ways now, I would so much rather have it this way.
Absolutely. And I think you're right. There is going to be a line in the sand that says this is the way it should be done, and collectively as companies, that's the encouraging part for me. I think collectively we are all getting better.
Right.
With the vast majority of companies, we understand who our customer is. We understand what our responsibility is to our nurses, and we are trying every day to get better. And we're also fighting forces that are sometimes above us that are saying, hey, can't do it this way.
Right.
No, we're going to, and sometimes that's painful.
Right. Well, and as any company grows, right? If you're going to have those pain points, it's going to happen along the way, and sometimes you're going to lose those hospitals that maybe, or the systems, or the MSPs, or whatever, that maybe don't have that same mindset.
Absolutely.
But you're right. At some point, there's going to be a line in the sand, and I believe that we're on the right side.
Yeah, I absolutely agree, 100%.
So my next question was, why'd you come to Omaha? I think we answered that already, right?
Well, and I'll tell you, this was, I think it's more interesting just in the way it happened. Like I literally, I think it was a few months ago, Steve and I were talking, and I said, hey, I want to come to Omaha and hang out with you. And he was like, sure, come. And I was like, all right, I'm going to come on the 22nd. And that was it. It was never like, it wasn't a strategic plan of 45 emails. It wasn't like, let me send you all these documents to sign beforehand. It was like, hey, here we are, come in the door, let's hang out. And that's the way it's always been. And it's collectively like, it's like seeing friends. It's like, a lot of the folks that you guys have, I know, I've seen, I've met.
Our guys have been to your office.
Yes. I remember, actually, it's a funny story. One of your client managers came in to visit us because we partner on some clients. And so I got to visit with, I think it was Ashley. And I got to visit with Ashley. And then the next day I walk in and I kind of look down my office and I see somebody sitting at a desk and I'm like, did we hire somebody? I'm like, I don't recognize it. I don't see so good so far away. So I like walked down and Ashley kind of turned around and he looked at me and I go, hey, and he goes, yeah, I'm working from here today. And I go, okay, like, that's cool, And so he just hung out in our office and worked. And that's unique. That's it didn't strike me until later that just doesn't happen.
Right.
Where we collaboratively work together to say, it's all good. The secret sauce, so to speak, in recruiting is now it's really tailored to our people. It's saying, hey, do your best to service nurses, and if that nurse decides to work with Atlas, that's great. If they decide to work with Republic, that's great too. But collectively, we are doing the right things.
Exactly.
So,
So, last question, and this might be a tough one. Like, we're in an interesting time right now. The summer wasn't awesome. The summer was a little flat. I think we're coming out of maybe one of the best periods that we've ever seen. And points in our industry that we've ever seen. Maybe not just period, obviously. So, what's next? Where do we go from here?
I guess I have drank the juice of technology. I truly believe the next phase in travel nursing is a massive revolution of technology. And I said this, I was speaking at TravCon on a panel, and that question came up, is what are nurses going to do different? I truly believe that the biggest change is going to be the timing that it takes to make decisions now. So we are moving into what in the industry we call a speed to market. So it's really about, here's a job that opens, how fast is a nurse getting presented to that, how fast are they getting interviewed, and how fast are they making a decision after that. And I in some ways, as a human, as a person, I don't, that's maybe not the best way to do things. But our industry also says that, if that job opens and that there are 50 nurses being submitted to them within 24 hours, there's an advantage to being number one.
Right.
So speed to market is huge, and as the technology companies, in which I think all of us are in some way or form, I think that technology is going to be the difference. So whether that is being, if you're a travel nurse and you're looking for a job in Omaha, and that job opens, you want to be notified within seconds that job is there. Your phone needs to be going off. The job is there. Here's the pay package. Do you want to be submitted? Click yes, and within 5 minutes, you're literally in front of the hiring manager, which may sound all doable, but there's a technology factor there we have to go to the other side of Everest to get there, and we're getting there. We're starting that climb. We're starting that process. So I really feel the biggest change in where the industry is right now is everybody's clamoring to be first in terms of just. As a service company, as a travel nurse service company, our goal is we know that you want this job, so let me try our hardest to get you there at first. And I think that's going to bring some challenges. I think people are going to push back. So I think people need to understand that, hey, if that's not your cup of tea, then you need to be more patient with how you're getting jobs, and more flexible about where you want to go. But I do believe that's where the industry's going. The other side of it is, and you alluded to this earlier, MSP and VMS, it represents about 54 to 58, depending on what you're reading, percent of the industry. That's going to grow, and you're going to see some consolidations this year. you know, companies are going to consolidate. The top is going to get bigger, which can be challenging.
Right.
And I think that we collectively, because of friendships and partnerships and collaboration, we have to be prepared for that. And I think the nursing industry as a whole is going to have to be prepared for what that collaboration, what that accumulation of companies is going to look like.
Right.
I don't have a crystal ball, so I don't know what that's going to look like. But
you can kind of see it already, though. I mean, if you're not, and I hate to keep coming back to this, but if you're not on board, right? If you're not, there's a lot of companies out here that do exactly what we do right now, right? And there's a lot that you and I, or you and Steve, or whatever, do with just within our little group that we've formed, right? There's power to that.
Sure.
And that power is it maybe not tomorrow, maybe not next year. It's going to mean something.
Well, and I think the end, you know, when it comes down to, let's just get down to the end of the road, which is really what we all focus on a lot, is providing opportunities to improve patient care for the people who need it the most. So when it comes down to it, you know, everybody has a why and a personal story that goes with this. You know, I remember what it's like to be in the hospital with my father and after his stroke, and dealing with and watching nurses deal with my father, who was not a good patient. He was a horrible patient. But the end experience is putting the right skilled nurses with the patients that need them the most. And if you back that process up, it's going to come down to the nurses want to be taken care of. They want to have a service level that is beyond reproach. They need to know that. They need to know that companies like Atlas and Republic, and I can name probably 4 or 5 others that I really feel are doing great jobs, is at the end of the day, are we there to help you? And are we giving you what you need so that you can bring your 100% to people like my father or, you know, my children? Because that's what, honestly, that's what I want. I want, when I go to a hospital, I want the nurse to be, man, I'm here. And throughout that process, if a nurse is they're not getting service the way they should, and they're not happy about their process, or they're not happy about their location or their compensation, that's going to affect what's going on.
It's going to come out in their patient care.
Exactly.
Yeah.
So our job is to have a small piece of that process so that at the end of the process, that patient can get the right care. Happy nurses generally, I think that they do better care. Right. I mean, if you're happy about what your situation is, I think it's going to show.
It's going to show.
So yes, you're right in saying if companies aren't on board with what our goals are, and our collective, like you said, that coalition goal, I think that they're going to start seeing, you know,
the opportunities won't be there for them.
Exactly.
Quite honestly, yes. Or, I mean, or to take a less negative approach, we'll have more opportunity.
Absolutely. Yeah. The flip side of it is if nurses are happy with our services, then we're going to have more opportunity to place them in better assignments.
Yep.
Yeah.
Exactly. Scott, thank you so much. I really appreciate you being here today.
I loved it.
This was awesome.
Appreciate your hospitality, and you know, Omaha and Texas, not too far.
Not too far. The door's always open.
Yeah. And you guys are welcome to come to Dallas anytime you want.
Heck yeah.
So appreciate it.
Scott, thank you. We'll see you next week.